Don't be silly, Gary. I don't get colds. I get the suds. No, Gary. If I had the suds, I'd have bubbles coming out of me.
You cannot catch a cold by being in the cold. There are a number of viruses out there that can cause a cold. Cold weather cannot. The one thing that we do have to worry about when the temperature does drop is hypothermia. So we're going to have a bottoming out of our core temperature. What you want to do is you want to try and cover yourself if you have blankets, anything that you can keep your chest, your neck, your head nice and warm. What your body's going to do is it's going to save those vital parts of your body, and it's going to somewhat neglect those that are not so vital. It's not unusual to have someone lose part of their nose or some toes or some fingers. That's the body trying to preserve itself.
I know a guy who knows a guy who went to the doctor once, and the doctor's office is a horrible, horrible place. Well, first, they make you sit in the waiting room.
Is that the horrible part, Patrick?
No, it gets worse. They make you read old magazine. Then the doctor pulls out his stethoscope. It's a device so sinister, so icy cold when it touches your bare flesh, it...
Now, a lot of people do have a fear of the doctor's office. On a personal note, I myself don't like to go to the doctors. For some reason, I've got this deep-seated, I guess, quote-unquote, fear of being at the doctor's office, and I've got what's called white coat syndrome. So my blood pressure usually shoots up to 160 or 170. Okay, so with regards to the magazines, what's up with that? If you've ever been into a doctor's office, you know that the magazines stink. They're old. We're talking about 2007 Newsweek. Who's going to read that? I actually did read recently. There was a very small study that was done as to why this is. So what they did is they put old magazines that nobody's going to read, and then they added some new gossip, celebrity-type magazines. After a couple weeks, guess what? All the new gossipy magazines, they were gone. So that's why you guys are stealing them. Yeah, so we're supposed to use, at least anyway, a stethoscope to hear internal organs. What I do is I'll put a stethoscope up to the patient's chest, and I'll listen to 4 different areas. So what am I listening for? I'm listening for that lub-dub, lub-dub. I want to make sure that the patient is in a good heart rhythm. I want to make sure the patient doesn't have any murmurs. Also want to make sure a patient doesn't have what's called a gallop or a rub, which is a pathological finding. Now, the other things we listen to, obviously the lungs. We want to make sure that the lungs are nice and clear throughout in all lung fields. So someone with congestive heart failure, we need to make sure that they don't have fluid in their lungs. That's where the stethoscope comes in.
I don't think so.
It seems you have the suds.
Patrick.
Are you ready for your treatment? Well, it looks like your gluteus maximus has made a full recovery. Your butt's all better. It's really quite amazing. It took 20 hours to put it all back together.
Oh, wow.
We actually ran out of staples and had to use a glue stick.
All right, so gluteus maximus. So what is this? Gluteus maximus is the main muscle of your buttocks. And aside from gluteus maximus, there's something called a gluteus minimus. That's also one of the muscles in your butt. Actually, post-op, they do use staples. A lot of times, staples are used to close sutures. Also, if we're doing an endoscopic procedure, we're going to have these little tiny slits. Sometimes those are closed with glue.
Guttural obfuscation brought on by gastrointestinal stress?
No, I mean the hiccups. Where'd you get your degree?
The hiccups. Don't usually see them that often. Usually when I see hiccups, usually it's going to be in a post-op state. Like patient comes back from surgery. That's when we sometimes see hiccups. Usually they're self-limited. So hiccups, they may last 20, 30 minutes and they kind of go away on their own. Now, I have had a couple cases where they've actually lasted 2 or 3 days. And there is a particular medication that we do give. It's called baclofen. And what that is, it's a muscle relaxant. Of all the medications out there that are used for hiccups, that's probably the most effective. Now, interesting story. I do know a surgeon. He and I have been on a number of different cases together. We have had patients who've had hiccups. And what this guy has actually prescribed in the medical chart, he actually wrote this down. 1 teaspoon of sugar to the back of tongue as needed for hiccups. Within 20 or 30 minutes, this actually worked. It cured the patient of his hiccups. And if you do want to impress your doctor, tell him that you've got synchronous diaphragmatic flutter, or SDF. And when he says, "What's this?" Tell me you got the hiccups.
Oh, it's a serious case, all right. Very serious. So I'll see you later for our date. Yeah, appointment.
So, you see in the clip that obviously the patient is hitting on the woman. He thinks he's a nurse. She's a nurse. She's actually a doctor.
Right.
Do you have any experience or any thoughts on women in the medical workplace and maybe some of the disrespect they have and et cetera, et cetera?
Now, this is something that you see. Obviously, this guy's hitting on this female doctor. In residency, also in medical school, this is something I saw all the time. And that's why a lot of these female doctors always make sure that they have not only their white, long lab coat, but they also have their stethoscope and their name on their lapel. That sometimes precludes them from getting, quote unquote, hit on. Not always, though. I used to hear this all the time from nurses. They would always get hit on by some old creepy dude. It's something that happens. It's unfortunate. If you are a patient, if you're an old creepy dude,
Chill out.
Frankly, Johnny, hiccups usually go away on their own, but if it's serious, come back this afternoon for a more thorough examination.
So what happens with a hiccup is it's a strong, forceful contraction of the diaphragm, which is usually controlled by either the phrenic nerve and or the vagus, vagus nerve. And what happens is it's a forceful contraction, which causes the glottis to snap shut, and you get that hiccup sound that is universal. Everybody knows what it is. Can't be mistaken for anything else. As I discussed earlier, these are usually self-limited, but sometimes they last for a while. What if it lasts for more than just a couple days? Then what's going on? Well, there are other causes of hiccups. A myocardial infarction or a heart attack can cause it. If you have bronchitis, if you have pneumonia, if you have pleurisy, all these can definitely cause a hiccup. So if you have a hiccup that lasts any length of time, sometimes it needs to be looked into. So what is this thing that she has on her head, this little round mirror type device? Well, it's called a head mirror. And it used to be used a long time ago. I personally have never used one. The way it was used is the doctor would pull this over one of his eyes. He would bring a light to shine into the mirror and into the patient's oral cavity. So it was used a lot by PCPs, but also by ENTs. So why isn't this used all that much anymore? Well, it was replaced by the pen light.
Computer, engage antibacterial environmental bubble.
Uh-oh.
System engaged.
Check that out.
Warning. Incoming germ manifestation approaching fast.
Boy in the Bubble. Is that a thing? That actually was a thing. I don't know if you guys remember the movie The Boy in the Bubble, starring John Travolta. I don't think he was actually the boy in the bubble. That kid had something called SCID, and at that time, he basically had to live in a bubble or a bubble-like environment. This kid, he lived to be about 12 years old, then he passed, but he passed on part of the cure for this SCID, so kids who are suffering from this no longer have to live in a bubble. So a lot of these patients are receiving bone marrow transplants, and for the most part, they're living a relatively normal lifestyle.
Computer, complete biological and molecular spectrum examination of entire laboratory. Searching. Entire laboratory has germ infestation.
So to keep a doctor's office clean, you got to have all hands on decks. You have to have good products. You have to instill in your staff just how important it is, especially nowadays. And what's gone on over the last couple of years, and I won't get into that. Everybody has to help out to keep that office environment nice and clean. And in the hospital, you're going to have organisms that are going to be pretty damn resistant to a lot of antibiotics. There's this one device which it's kind of like a robot. It kind of wheels itself around into these hospital rooms, emitting UVC light. Studies have been pretty promising. I think there are some hospitals that are actually using this.